Well, good morning or good afternoon or good evening, wherever you are, in Africa or in the diaspora, in Zambia and in other parts of the continent. My name is Katele Kalumba. I've been a common face in many countries. I'm a public health scientist and as well as a mental health scientist. I'm a graduate of Toronto as well as Washington University in the United States and University of Zambia here in Lusaka. I've been a senior research fellow in public health at the University of Zambia in the early 80s, and also chief scientist, rather chairperson of the scientific group on global program on AIDS under the late Jonathan Mann, and also worked very hard to harness the UN agencies to set up UNAIDS. And I was an executive board member of WHO. When I was an executive board member of WHO, I worked in different departments doing research in mental health, in reproductive health, in tropical diseases, and tropical disease research center here in Zambia as well as in WHO in Geneva. So I have a wealth of experience working as an advisor to the World Bank President Wolfenson, the only African advisor at the time, external panel member of the external advisory group to the World Bank on Population Nutrition and Health, and also external advisor to Kobe Health Center, WHO Health Center in Japan. I worked very hard to set up HIV/AIDS programs with my colleagues from the US and the UK, and also from Uganda, Noreen Caleb and others, across the continent when we were visited with the pandemic of HIV. Now we have a different challenge. Apart from my public life, as I've said, I've served in many ministries, 20 years in the Parliament. I've realized that COVID is real. It does not respect status or your academic credentials. It only respects your ability to follow those procedures and sanitary regulations that have been put in place for you. And if you don't respect social spacing, you don't respect washing your hands every time as often as possible, when you're in public places, mask up, you are likely to be visited with this pandemic. And let's not play pseudoscientists. We do not know enough about COVID in terms of the range of damage that it's causing to the human body, and also the social chaos that it has spun, both economically, politically, and socially. It has changed our lifestyles. And I think it's important that we work together, we cooperate, and we do not play pseudoscientists and try and give myths to people about that the COVID is not here, that we are pretending. We are not pretending, it is real. So I do urge you, particularly my people in my sub-chiefdom in Chienge, whenever you test positive, please don't run away from the health workers. Those tests are real, they are working, they are confirmed when I came to Lusaka, that in fact they are real. I was admitted on this. I was tested on the 16th in Chienge. It was confirmed on the 18th when I arrived here in Lusaka on the 19th. It was confirmed that the test was positive, and I've been going through treatment, and I feel the staff of the hospital facility here, and also the frontline workers across the country and across the continent and the world, who are putting their lives at arm's length to ensure that we all stay safe. Please, let's follow their advice, their counsel, so that we are all safe. We can't afford to lose so many lives, have such tremendous amount of disruption to our way of life. just because of pseudoscience as well as emotional temperament such as we witnessed in the United States, which delayed action that could have saved so many lives. That's a very bad example of governance, of leadership. While vaccines may be a scare to some, my appeal on this one is very simple. We have scientists in Africa as well as in the diaspora. We have the capacity to disassemble the different elements, components of any scientific formula, and be able to tell whether it contains particulars or elements or properties that may harm our people. The issue is of science. It's not of or simply myths about racial annihilation and so on. Those can exist and they will never stop. We fear each other. I mean, we are in them; they're not in us. I mean, we fear our shadows. As a result, we cannot stop to learn from their science. Neither can they stop to learn from our science. We have to learn from each other's science and pick that which is correct and use it for our own survival. To tell our people that don't do this, don't do that, even when you don't have a grain of scientific truth to it, is dangerous. Naturopathy and all these other herbal medications are being encouraged in hospitals such as this one. Your steaming and so on is being encouraged. But we are not saying forget about biomedical sciences. No, I think it's important that the biomedical drugs that work are used. Some of these are antiviral, they work. They have been developed in countries such as India, which is very good at Ayurvedic medicine. And they're showing that, of course, like all drugs, they have side effects. Not even our traditional drugs have side effects. But it's the extent of the side effects, the manageability of side effects that we should worry about. I think those that cause even more, which become iatrogenic and cause more danger to life than perhaps doing nothing would be, those are the ones we should fear. So I encourage you, please, let's stop being pseudoscientists. Let's look at the science in the face. Let's look at the data in the face. Let's examine this data. Even if it means going under the table and scrubbing that data, let's grab it and study it and tell our people, this is what's wrong with this data. This is what's wrong with this vaccine. These are the properties that are dangerous to us. But if we don't have that information, let's not create unnecessary alarm that will harm our people more than will help them. Our governments may not be informed, but we are there. That's why we went to school, to inform them. That's why we went to the same colleges, Harvard, Oxford, Cambridge, Toronto, MIT, whatever. We went to these colleges to learn the same knowledge, and we have come back with the same knowledge to our continent in different parts of the diaspora, particularly those in the diaspora, where they are in those colleges themselves. Some of them are professors. Surely they should be able to share that knowledge with us and tell us this is not good for our black people. So let's preach. Yes, we need to address our spirituality too. I must mention this, but not the spirituality that avoids people from taking medication when they need to. That is dangerous spirituality. We had an experience like that in the early 60s here in Zambia, and we lost a lot of lives when we have preachers who were preaching very negative things to do. And we have seen in different parts of the world, including the Caribbeans and as well as the States, lives lost because of warped preachers who believe that they are prophet saviors who can do magic and suddenly make people come to life when they can't do it. COVID is real. It is a viral disease. It is like flu. It can mutate in many ways. and we don't know exactly how many ways it can mutate in. Sometimes one vaccine may work in some areas, it may not work in other areas. There are substrates of different kinds. Like we noticed this with HIV/AIDS. We still are struggling for the vaccine. So please, let's use science. And I call upon everybody to work with policymakers, to work in communities where we are, to educate our people, use the language they can understand, allay their fears, encourage what they can do to prevent contacting COVID-19, and also to protect their families, improve their nutrition, ensure that when they cannot, when they feel the tightness in the chest, the coughs, the persistent coughs, and all these small symptoms that they often ignore, malaria, everything is malaria in the village, they go for testing. And whatever they are told, let them listen to their health workers. I think they're trying to do a good job for them, and they're paid to do so. We thank them for the sacrifices they make for us, because they are actually exposing themselves to COVID-19 as a result of our health. So I thank you, and I thank the staff of this institution. I won't mention where I am, but it is a fantastic institution, modern, very professional, and they respect your privacy, and I applaud them. They have captured the best in the country, and they have put them together, and they're helping save lives. God bless you all wherever you are, and I look forward to smart cities when we would live with less disease. I look forward to a world where our families will nurture their children and let them grow in healthy environments. I dream of a world where learning will be continuous and we'll be sharing that knowledge without patenting it as personal property and selling it as commodities. I look forward to a world where work will be enriching and humanizing. And I look forward to a world where we would use we will have a creative use of leisure time. We would play not just for commerce, but for entertainment, for enjoyment, for being creative, for emancipating ourselves, for expressing ourselves, for dreaming the future, to bring the future to today. I dream of a world where our environment will be sustainable, and please come. Let's think hard together on those ideas. I know there are many who share the same visions, and I would like to see those 5 pillars: nurturing families, continuous learning, work that is dignifying, that's not alienating, creative use of leisure time, sustainable environment. Those are my life's pillars. I believe in them. Thank you. God bless you. Salam.